what my current training style is and some of the main things that I'm doing right now with my body for training. So I wanted to kind of talk about some key points. My training style isn't anything in particular right now. I would say it's more along functional style of training, but not in the traditional way one would think about it with like CrossFit, functionality, stuff like that, but definitely in like ability and capability in life and hobbies and just overall feeling really, really good, really fluid, pain-free, and making sure that I've got tons of mobility in there and stretching so that my joints feel really good. So that's kind of my main focus right now, but some of the key things within that would be I'm really focusing on ribcage positioning and also pelvic positioning, so I can always get into greater detail, but if anyone has questions, please ask. But so I'm doing a lot of that, really focusing on like correcting some of my rib flaring, things like that, especially after my knee surgery. Left to right side has been very, very different, especially like within my obliques, intercostals, lats, as far as my midsection goes, and then obviously my hips down, there's a lot of asymmetry. So with that being said, I'm also doing things like training my hips quite a lot to really, really balance out my hip joints, making sure that I have equal stability and capability out of both left and right side. Because my knee surgery is on my right side, my left side has become quite a bit more dominant and strong, which is amazing, but also at the same time, I do find myself off balance at times, and ever since I started training the way that I am now, I've been feeling so much more balanced. My dancing, my walking, my running, everything has been feeling so much more comfortable, and I'm able to stay more on my axis and really be right on top of myself instead of falling one way or another. And then with that, with my hip training, I'm doing a lot of like traditional style training for the hip joints, and then obviously the surrounding like hip flexors, glutes, quad hamstring, stuff like that. But I'm also training with what I call an open hip. So I'm doing both an open hip and a closed hip style of training. And I can always get into more detail with what that is and what that looks like to me. Frankly, that has been a huge, huge player. And I'm really working in different planes. So a lot of times, if you were just standing up straight, you're working one set of muscle groups and really triggering different parts of the hip. And so I'm taking myself out of those positions, and I'm really, really training some odd movements and really trying to bulletproof my hip joint and also my knees. So that has been a huge game changer within my current training. And it's something that I've done in the past before, but in this case, I'm definitely putting that as priority. So I've always been a big advocate, but I'm doing less barbell training now at this moment. I still am, so don't get me wrong. I still am doing barbell training in all of my main three and all overhead press and all that good stuff and other barbell accessory work, but it's almost become secondary, and I'm doing a lot of my accessory movements first, which is really, really interesting. And then of course, you know, I'm being very selective as to what gear I'm using to make sure that I'm not using my gear as a crutch. And when I say gear, I mean physical apparel, you know, weight belt, knee sleeves, wrist wraps, other things like that, and even using, you know, band assist stuff or not being under a dead load and all that stuff. So the rabbit hole, it just goes further and further down. I'm trying to think if there's anything else. I've been doing a lot with my shoulder rehab. I've been having some issues on my right side because that was the side that I've dislocated many a times outside of training. So that is from other kind of abrupt accidents. So I'm rehabbing that. It's feeling amazing. I'm doing a lot of that through kind of that intercostal work, some pec and clavicle, kind of mobilization, stretching, really working on my scap and subscap stuff, and just overall the entire shoulder girdle. So that's something I think a lot of people miss out on, is they usually work the delts, but then they don't realize how much the back comes into play, the chest comes into play, everything is all working together, and then how that all relates to the rib cage. So those are all things that I'm really focusing on, and just overall really rebuilding my right side, and then finding some holes and finding some other mobilization within my left side because of it kind of compensating during the time of my surgery. So just making sure that both sides are free moving and kind of unstuck, and it's been really great so far. So I would say right now I'm hitting a lot of my goals as far as being able to have free movement and mobility under a load, which has been really fun because it's the first time I've been able to do that in a while. And then just being pain-free. So I'm very grateful, and that's kind of why I wanted to jump on here, was really kind of emphasize some of these main things that I'm doing. So thanks, guys.